The house is silent, yet your body is not. You wake in a room that should feel safe and steady, but every few hours your legs swing over the side of the bed and the morning loses power before it begins. If this has been your week, hear me clearly. You are not broken. You are not alone. You still have levers you can pull that change how you feel. I am Dr. Emily Stone. Picture your vitality as the current that runs through a home. When the current is strong, every room is bright and every switch responds. When the current flickers, shadows creep into places that once felt simple. Blood flow, sleep, and hormones follow the same pattern. The path forward is not another quick pill. The path is learning when to nudge the system and when to let it rest. Stay with me through the final minute. I will give you 3 daily habits that protect the prostate and support the pillars men over 60 care about at most: testosterone, strength, performance, and dependable energy. I will also share 2 small upgrades that few people teach, yet they build results you can feel within weeks. You will know what to do, when to do it, and how to tell whether it works for your body. There is urgency in this message because every week of poor sleep and worry chips away at confidence in the bedroom and in daily life. The moment you create steadier nights, you open the door to better mornings. Better mornings invite movement, connection, and the return of quiet pride. That is the path we are building together. If you value clear steps and respectful talk of real male concerns, subscribe now and turn on the bell so you do not miss the next guide. Type 1 in the comments if this already helps, or type 0 with your question, and I will answer as often as I can. Tell me your city or state so this feels like a circle, not a crowd. Good men learn faster when they learn together. When you subscribe, you receive weekly routines designed for men over 60, simple science explained in plain language, and realistic timelines so you know what to expect and when. You also help another man find this message at the exact moment he needs it. You will learn 3 daily habits that fit normal life and 2 add-ons that multiply the benefits. Each habit includes the promise, the reason, the exact steps, a real patient story, a safety reminder, and a simple way to track results. Everything connects back to testosterone, sleep, circulation, and confidence in intimacy. Habit 1. The hydration window. Promise. Guard your nights by moving most fluids earlier and giving your bladder a peaceful curfew so your brain can do its night work and your hormones can follow their natural rhythm. Reason. Concentrated urine irritates the bladder and the area around the prostate, which drives urgency at night. Spacing fluids earlier preserves sleep architecture. Steadier sleep supports the morning testosterone pulse that feeds strength, mood, and sexual desire. Steps. Aim for roughly 3/4 of your daily fluids before late afternoon. After dinner, take only small sips as needed. Create a window of 3 hours without drinks before lights out. Add a double void before bed. Urinate, relax for 1 minute, then urinate again without pushing. Keep your shoulders loose, your jaw soft, and your breath slow so the pelvic floor can release instead of bracing. Story 1. Jack, 67. Jack woke 2 to 3 times every night and felt slow by noon. He moved coffee to the morning, finished his water goal by 5, and practiced the double void routine. Within 2 weeks, he slept 5 to 6 hours straight on most nights and felt a return of calm interest in morning activity. His partner said he laughed more at breakfast. Safety. If you take diuretics or have heart or kidney conditions, coordinate changes with your clinician. Seek care if you notice pain, fever, burning, or blood in the urine. Tracking. Keep a diary for 3 days that lists drink times, drink amounts, urination times, and nighttime awakenings. Repeat the diary after 2 weeks so you can see the pattern shift in black and white. Testosterone and performance link. Better sleep preserves the morning hormone signal and improves motivation for movement, which creates a healthy loop for strength and intimacy. Habit 2. The walk after meals. Promise. Turn food into fuel instead of inflammation with a quiet stroll of 10 to 15 minutes that works while you sleep. Reason. After meals, blood sugar rises. Gentle walking recruits muscle as a sponge that absorbs that sugar. Smoother blood sugar means less inflammatory noise across the body and a calmer nervous system at night. Regular movement after meals improves the inner lining of blood vessels, which supports pelvic circulation and confidence over time. Steps. Start with 10 minutes after lunch or dinner at a pace that lets you speak in full sentences. If the weather is poor, march indoors, walk hallways, or use a few safe stairs if your joints allow. Anchor the habit to a cue you already have. When you set your fork down, start a short playlist and walk until 3 songs finish. Add easy calf raises at the end if your balance allows. Story 2. Marcus, 72. Marcus had heavy legs by evening and little desire to exercise. He began with 12 minutes after dinner and 2 minutes of calf raises. After 1 month, he went from 3 bathroom trips to 1 on most nights, and his morning mood lifted enough to add chair stands and wall push-ups. The win was subtle, then obvious, and it felt like self-respect. Safety. Wear supportive shoes and choose a safe route. Stop if you feel chest pain, severe breathlessness, unusual dizziness, or leg pain that does not ease with rest. If you have balance issues, select an indoor path with a chair nearby. Tracking. Rate your energy for 2 hours after the walk on a scale from 0 to 5 and track bedtime urgency on the same scale. The goal is a gentle upward trend within 2 weeks and a clearer night within a month. Testosterone and performance link. Less inflammatory stress and better endothelial function support hormone signaling, recovery and erectile confidence. The effect is gradual and real. Habit 3. The evening pelvic reset. Promise. Relax what is tight, wake up what is weak, and let the stream run without pushing or panic so the body is not fighting itself at the very time it should be settling. Reason. Many men unknowingly brace their pelvic floor all day. Constant clenching narrows the outflow and confuses the urge to void. Diaphragmatic breathing and gentle hip mobility tell the pelvic floor to let go and tell the nervous system that bedtime is safe. A calmer system supports deeper sleep and better morning energy. Steps. Lie on your back with knees bent and feet flat. Place 1 hand on your chest and 1 on your belly. Inhale through the nose for a count of 4 and feel the belly rise as the pelvic floor softens. Exhale for a count of 6 and feel the belly fall as the pelvic floor releases. Continue for 3 minutes. Add 5 slow hip openers and 5 gentle pelvic tilts. Finish with 2 quiet minutes of seated breathing with your jaw unclenched and your hands relaxed. Story 3. Bill, 63. Bill believed his bladder was weak when in fact his pelvic floor was overactive. 2 weeks of nightly pelvic resets reduced his bedtime urgency and he stopped power pushing, which had strained his abdomen for years. His stream steadied and he stopped planning his evenings around the bathroom. Safety. If you have significant pelvic pain, new weakness, numbness, fever, or sudden retention, seek medical care. If you have a hernia repair or hip replacement, ask your surgeon about safe ranges for motion. Tracking. Rate bedtime urgency from 0 to 10 each night for 14 days. Expect ups and downs, yet look for a gentle downward drift. Pair this rating with your diary so you can see how hydration timing and the pelvic reset interact. Testosterone and performance link. A calmer stress response lowers the chemistry that competes with healthy libido and sleep quality. Many men report more ease in initiating intimacy when the body feels safe and unhurried. Bonus add-on A. The sleep-protecting evening ritual. Treat sleep like a prescription you fill nightly. Dim the lights at a consistent time. Keep the bedroom cool and quiet. Close the kitchen 3 hours before bed. Take a warm shower, then enter a cooler room to cue the body for rest. If you share intimacy, keep it gentle and connected. The goal is closeness more than performance, and closeness often supports performance later. Story 4. Ed, 70. Ed set a steady lights-out time and stopped late-night snacking. He did not feel younger in a single night, yet after 3 weeks he said mornings felt like his again. He noticed less irritability and more willingness to walk with his neighbour before breakfast. Bonus add-on B. Strength snacks for steady power. Small, frequent doses of strength beat a single hard workout that leaves you sore and stalled. Twice daily, perform 1 set of sit-to-stand from a chair, 1 set of wall push-ups, and 1 set of calf raises. Choose a number that is challenging yet safe and add 1 or 2 repetitions every week or 2. Celebrate consistency more than intensity, because consistency wins at this age. Story 5. Raymond, 66. Raymond added strength snacks after his walk after dinner. In 6 weeks, his posture steadied, his joints felt more comfortable, and he felt more confident initiating intimacy. His partner noticed his calmer mood first and his steadier energy second. Scope and safety. These habits and add-ons support prostate comfort, sleep, and energy. They do not replace medical evaluations, medications, or procedures when needed. Work with your clinician, especially if you have cardiac, orthopedic, neurological, or urologic conditions that require monitoring. Caffeine needs a curfew, so keep coffee and strong tea to the morning. Large salty dinners pull fluid into the bladder after bedtime, so favor lighter evening seasoning. Break long sitting every hour with 2 minutes of standing or gentle movement to refresh pelvic blood flow and ease stiffness. Address constipation with fiber, fluids earlier in the day, and unhurried bathroom time, because a crowded rectum can amplify urinary urgency. Include nitrate-rich greens at lunch or early dinner to support healthy blood vessels. End the day with a brief gratitude note to settle the mind before sleep and lower the background noise of stress. Common mistakes appear again and again: flooding with water after dinner to make up for a dry day, straining on the toilet in the name of emptying, ignoring snoring that fragments sleep and drains energy the next day, skipping the walk on stressful days, which is exactly when a short stroll would clear the system. You can avoid these traps with gentle structure, a simple checklist, and a little accountability from a friend. You now have 3 daily habits that protect the prostate and support the pillars of male vitality after 60. A smarter hydration window protects sleep. A walk of 10 minutes after meals turns calories into calm. An evening pelvic reset releases unnecessary tension. Add a sleep-protecting ritual and strength snacks, and you have a routine that respects age while reminding your body how to work for you. Set expectations like a craftsman who builds strong beams, one careful cut at a time. In 1 to 2 weeks, many men sleep more steadily as fluids shift earlier. In 3 to 6 weeks, the mix of walking, breathing, and small strength sessions smooths the day. In 8 to 12 weeks, small changes compound into confidence, which looks like a steadier stream, calmer nights, and more reliable mornings. If symptoms remain severe or progress, meet with your urologist and make screening and treatment decisions through shared conversation without shame. Aging does not break a man. Giving up does. Suppose this message helps you, like the video and share it with a friend, a brother, or your father. Type sleep if you will protect your night starting today, or type walk if you will move after dinner. Subscribe and ring the bell so you do not miss the next guide, where I will teach an evening sequence that lasts 9 minutes and pairs breath, hips, and shoulders to deepen sleep and support testosterone. Our community grows stronger when we practice together.